At 45, John, like many men, started noticing subtle changes in his daily routine. In the mornings, he felt a strange sensation in the pelvic area, more frequent urges to urinate, and occasionally a mild pressure he couldn't explain. At first he ignored it, thinking it was just a part of aging. But as the symptoms persisted, one thing became clear: his body was trying to send him a message. What he discovered next completely changed the way he viewed his health. He realized he had never paid attention to his prostate, a small gland about the size of a walnut located just below the bladder. Often overlooked, this gland plays a vital role in male reproductive function. It produces the majority of the fluid that makes up semen and provides nutrients and protection for sperm. But what most men don't know is that the prostate needs regular stimulation to stay healthy. Yes, it needs to be activated, moved, and stimulated. And one of the simplest and most effective ways to do that is through regular masturbation. Scientific evidence now shows that the absence of stimulation in this gland can lead to several problems, including fluid buildup, inflammation, and even an increased risk of more serious conditions. One of the first negative effects of prostate inactivity is known as prostatic congestion, a condition where fluids produced by the gland accumulate because they're not regularly released. So, this congestion can cause heaviness in the lower abdomen, constant urges to urinate, a weak urinary stream, and in some cases pain during or after sex. The problem is it's pretty silent, really common among men over 50, and honestly, it's often mistaken as just normal aging. On the other hand, regular masturbation actually works like a natural cleansing mechanism. With each ejaculation, the body performs a kind of cleanup in the prostate, releasing old secretions and promoting the renewal of seminal fluid. This helps reduce inflammation, improves gland function, and helps prevent discomfort. A study conducted by researchers at Harvard University and published in the Journal of the American Medical Association followed over 30,000 men for nearly 2 decades. The conclusion was clear: men who ejaculated more than 21 times per month had a significantly lower risk of developing prostate cancer than those who ejaculated less than 7 times per month. Another important benefit involves hormone regulation. During ejaculation, levels of dihydrotestosterone, or DHT, which is a hormone derived from testosterone, temporarily drop. Now, while DHT is definitely essential for male development, it's directly linked to prostate enlargement as men age. So frequent ejaculation actually gives the prostate these brief breaks from hormonal stress, kind of acting like a pressure relief valve. In my clinical experience, I once treated 2 brothers in their 50s. One avoided any form of self-stimulation for cultural and religious reasons, believing it was inappropriate. The other maintained a healthy and guilt-free routine. When we compared their test results, the difference was, really striking. The first had elevated PSA levels, an enlarged prostate, and frequent discomfort. The second had levels similar to a much younger man, without symptoms, and in excellent health. And that's not all. Masturbation also strengthens the pelvic floor muscles, the same ones responsible for urinary control and erectile function. The muscular contractions during orgasm act like a natural workout, helping to prevent urinary incontinence and erectile dysfunction, 2 common issues in men over 60. Furthermore, regular ejaculation improves sleep quality. After orgasm, hormones like prolactin and serotonin are released, promoting relaxation and well-being. Cortisol, the stress hormone, drops. And better sleep supports hormone balance, cell regeneration, and immune health. Everything a man over 40 needs to age well. But here's the real obstacle for many men: guilt, shame, the belief that masturbation is something only teenagers do, that after 40, 50, or 60 years old, it becomes unnecessary or wrong. That's a myth, a cultural taboo that needs to be broken. I've had patients like Robert, who's 58, and honestly he spent much of his life avoiding any conversations or practices related to sexuality, just out of fear of judgment. He lived with anxiety, low self-esteem, and those recurring urinary symptoms that just wouldn't go away. But after we had an open discussion, and he started to understand the physiological effects of masturbation, plus building a routine of intimate self-care, everything really changed for him. His PSA levels dropped, the symptoms disappeared, and most importantly, he regained control over his body. The truth is, taking care of your intimate health isn't just about short-term pleasure. It's really about long-term organ function, disease prevention, hormonal balance, and self-esteem. Masturbation is a fundamental part of male health, and honestly, it should be treated that way. The ideal frequency will vary depending on your age and lifestyle, but generally it's recommended for guys in their 40s to go for 3 to 4 times per week, for those in their 50s 2 to 3 times per week, and if you're 60 or older, at least once per week. More important than frequency though is consistency. Stimulating the prostate naturally and moderately lets it stay active and functional, even as you age. So, it's not about avoiding relationships or emotions, it's really about prevention. Prostate health is no longer something we can afford to ignore or treat as taboo. Just as we care for our heart, our muscles, or our skin, it's time to include the prostate in our self-care routine. If you're in your 40s, 50s, 60s, or even older, it's never too late to begin. Listen to your body, respect its signals, and create a routine that works for you. If needed, seek medical guidance. But, don't wait for symptoms to show up. Many men after learning this say the same thing. I wish I had known this 20 or 30 years ago. Don't let that be your story. If this content helped you in any way, share it with other men. Help break the silence and stigma around this topic. Talking about male intimate health is honestly an act of courage, responsibility, and above all, self-respect. And remember, taking care of your body isn't vanity, it's an investment in your vitality, your confidence, and your quality of life.